Hi, welcome back to Girl Talk. If you're just tuning in, we're here at Monroe Furniture Center today. Later in the show, checking up with owner Jerry Beckman, talking accessories.
Excellent. It's great having you. And
Yeah.
Janet's not here. I hear she's in Mount Horeb.
She is. She's visiting Dr. Angela Cody at Village Smile Care, who always has some great information. Let's take a look.
Studies have shown that many of us are unhappy with our smile, but today there are so many options for improving your smile, and who better to talk to than Village Smile Care right here in Mount Horeb. And with me is Dr. Angela Cody. Can we start at the beginning, Dr. Cody, with cosmetic dentistry? What is that exactly, and how is it different from, I guess, regular dentistry?
Sure, great question. The American Academy of Cosmetic Dentistry defines cosmetic dentistry as dentistry aimed at creating a positive change to your teeth and gums. To me, I think of cosmetic dentistry as helping our patients have their healthiest and most beautiful smile, and whatever they find is beautiful. I also feel that we embody it in all our general dentistry practices, so whether someone's getting just a small filling or a full mouth rehabilitation, we always try to make the smile look as nice as possible and also blend in with the natural teeth and face and make it look really lifelike and not, cosmetic and fake.
That's interesting. When I do think of cosmetic, I immediately think of how something looks. And in that definition, it addresses the health of your smile too. That's great.
Yes.
So whitening our teeth, that's one way to make your smile look better and younger, I suppose. And there's so many options. There's professional and there's the strips and the trays. What's the difference between doing a professional whitening versus something over the counter?
Yeah, so a lot of people these days are using the whitening toothpaste, and they do have their use. However, they're not going to change the actual internal color of the tooth. They only address surface stain. So when you come in for your cleaning, we polish your teeth. It does the same thing. So between visits, you may get stain. However, they can be quite abrasive. So people that use them daily or twice a day, those abrasives can actually wear away the enamel over time. So they can be a little dangerous in that regard. Stuff over the counter like white strips and things like that work great. They will take more time than professional whitening because they can't use as strong of gels.
Sure.
And also they're not as custom fit, so you may miss areas of the tooth, or you may also burn or irritate the gums because they're not protected.
I suppose getting between the teeth
Yes.
could be kind of tricky.
Yeah.
And what if folks are not getting a good result with their whitening efforts?
Yeah, so some teeth are just so dark that even with whitening gels, they're not going to get as bright as a person may like. They may have some staining or old fillings that aren't going to change color. There's also people that really can't whiten because they become too sensitive. Even though it is very safe, it can cause tooth sensitivity, which is temporary. So some people just don't do well with the whitening, so there are other options. The most common option for people that want whiter, brighter teeth and don't have good luck whitening is veneers.
Okay. So let's talk about veneers.
Yeah.
And I don't know. You start with what you think is important about considering getting one.
Yeah, so some people also, we talked about whitening not working. Some people just have smaller teeth, worn teeth, the size and shape isn't correct. And so those issues can all be addressed with veneers. They're basically like a thin shell of porcelain, so similar to a crown, but very conservative because we only need a thin layer to bond to the tooth, and they can whiten the teeth and make them straighter and more aligned.
Is veneer the same thing as getting caps?
So a cap would be more like a crown and cover the whole tooth. The veneer is just on the outer surface and the biting edge usually.
Okay. You mentioned that veneers can give you straighter looking teeth. Is that a good option if you want straighter teeth, or should you consider orthodontic work?
I think it's good to look at everything. So a lot of times orthodontics may be more conservative, but even with orthodontics, we may not be able to address all your issues. So people that have small teeth or large spaces between the teeth and the teeth are too small, may benefit from veneers. I myself actually have veneers, and I had braces as a child, so my teeth were straight, but I didn't have good luck whitening. I was sensitive, they didn't get that white. I also had some wear, and my teeth were a little smaller, so the veneers gave me a much bigger, fuller smile, and I was so happy I did it.
So genetics is definitely a factor here
Yes.
too. Let's talk about the process of getting veneers. We have about a minute left. Is it painful? What does it entail?
It's really not painful at all because we're not removing much tooth structure at all, and they're so thin. Most patients are, very comfortable. The patient comes in, we get some models and photos of their teeth to plan the case. Then we gently shape the teeth and we make a temporary trial smile, and they'll wear that a few weeks to make sure they like the shape and everything that we're doing with their teeth. Once they approve that, in a few weeks we can have the permanent veneers and cement them all on, so then they have their new smile. So it's very, very pain-free, very easy. and the patient's very involved in the process of helping choose their new smile.
I don't know if this is a silly question. Are they usually top or both top and bottom teeth?
A lot of people can just do top because that's what shows when they smile,
Yeah.
but some people will do bottom as well.
Alrighty. Well, thank you, Dr. Angela Cody's right here at Village Smile Care, and we're Girl Talk. We'll be right back.